How can poor sleep affect your health? As I mentioned before, your sleep is considered your main body repairing and updating system. Most time you need to shut down your device or computer to restore your device functionality, same way how your body works. During your sleep, your body will work to fix what was damaged during your long day. If your sleep quality is poor, you might experience several medical problems. The followings are the most common medical problems could be associated with your poor sleep. 1. Hypertension. As I mentioned before, during your sleep, your blood pressure drops. Also, your cortisol decrease. If you have sleep apnea, this will lead to high blood pressure. If you are on more than 2 medications for blood pressure or it is hard to control, you need to check your sleep for sure. 2. Irregular heartbeats. Like atrial fibrillation, obstructive sleep. Apnea can cause atrial fibrillation as it increases the pressure in the lungs and cause hypoxemia during the night. Also, it increases the sympathetic nervous system, which lead to increase of your heart rate. Irregular heartbeats can cause central sleep apnea. 3. Heart failure. Sleep apnea can exacerbate your heart failure as more pressure will develop against your heart, and low oxygen can further damage your heart. Also, heart failure can cause central sleep apnea. 4. Stroke. You can get a stroke as a result of sleep apnea or from atrial fibrillation caused by the atrial fibrillation. Also, stroke can cause central sleep apnea. 5. Chronic fatigue. Sleep is the main mechanism to get rest for your body. If you are experiencing fatigue, think about your sleep. 6. Depression and mental health issues. Good sleep will improve your mood and satisfaction. Some mental health can cause also severe sleep issues, which can, in a vicious cycle, worsen the mental health issue. 7. Fibromyalgia and chronic pain. Good sleep will increase your pain threshold. High percentage of fibromyalgia patients have sleep disorder like sleep apnea, insomnia, and restless leg syndrome. 8. ADHD, attention deficit hyperactivity disorder. Poor sleep can affect your concentration and memory, and it can cause irritability. You might be misdiagnosed with ADHD, but your sleep could be the key. 9. Uncontrolled diabetes. Poor sleep will lead to high cortisol in your body, and low oxygen at night will increase your inflammation and make your body more insulin resistant. 10. Uncontrolled rheumatological disease. Low oxygen at night will increase the inflammation in your body, which can affect your rheumatological disease control. 11. Dementia and Alzheimer. Studies now link dementia to sleep apnea and poor sleep. As I mentioned before, during your sleep, your brain gets rid of its toxin, and if this interrupted, it will lead to accumulation of amyloid protein, which can cause Alzheimer. 12. Polycythemia, which is an increase in your hemoglobin in the blood. If you are diagnosed with polycythemia, you want to make sure you don't have sleep apnea. 13. Testosterone deficiency. Your testosterone is released while you are asleep, especially during your REM sleep. If you have this problem, you want to make sure your sleep is not the underlying cause. 14. Pulmonary hypertension and exacerbation of lung disease like asthma and COPD. 15. Poor immunity. You may get more infections if you have poor sleep.